All right, listen up. Your mission is to master paraneoplastic endocrine storms. We're talking about rogue signals where a tumor literally hijacks the body's entire signaling system.
We call this the mimicry war, and it is a battle of deceptive signals. You've got cancers masquerading as normal glands, and you know what? If you can't tell the difference, you're going to end up treating the wrong organ completely.
So first up, meet the stone factory, squamous cell lung cancer. This thing just starts pumping out a molecule called PTH-related protein, or PTH-rp. It acts just like PTH, skyrockets the patient's calcium levels, and here's the kicker, it simultaneously tells the body's actual parathyroid glands to shut down.
Then you've got the water and salt disaster. That's small cell lung cancer, and this one is a real double threat. On one hand, it's secreting ADH, which causes SIADH, and on the other, it's pumping out ectopic ACTH, which triggers this incredibly rapid, often lethal Cushing storm.
Okay, burn this next part into your brain. This is the crucial logic gate. Ectopic hormones are completely autonomous. They never, ever listen to the body's normal feedback loops. They don't care about suppression signals. That right there, that's the key to everything.
Before we proceed, a mandatory protocol. Please be aware this content is for educational purposes, specifically for international medical exams. It is not and should not be considered medical advice. All clinical decisions require consultation with official guidelines and a qualified specialist.
Okay, theory's over. Let's put this into practice. Picture this. A patient walks in. They've got extreme hypertension. Their potassium is in the basement. Severe hypokalemia, and they have hyperpigmentation. You check their cortisol, and it is just massive.
So here's the million-dollar question for your exam. You run a high-dose dexamethasone suppression test, and those cortisol levels, they don't budge, not even a little bit. So is your next best step a brain MRI to go hunting for a pituitary mass?
No, it's a trap. See, a pituitary adenoma, it usually listens, at least a little bit, to that high-dose dex. But if you get zero suppression, you have to think the source is autonomous. And all those severe symptoms, the hyperpigmentation, the low potassium, those are huge clues that ACTH levels are off the charts. That's not coming from the brain. For your boards, the next best step is a chest CT. Don't waste time looking at the pituitary when the lungs are practically shouting at you.
Okay, you've disarmed that first trap. Nicely done. But now you're up against the system's firewall. This is the one that trips up almost everybody under pressure. And that's getting small cell and squamous cell confused.
So, here it is, your secret weapon. The mnemonic that's going to disarm this trap every single time. Just remember, squamous is for S-tones because it causes that high calcium. And small is for S-salt and S-secretion because it causes the salt problems from SIADH and it secretes those ectopic hormones.
Let's lock that in right now. If the question gives you a smoker plus high calcium, bam, it's squamous. If it's a smoker with low sodium, you better pick small cell. Just think about where the damage is happening. Squamous affects the bone. Small cell, it's hitting the brain with SIADH and the adrenals with that ectopic ACTH.
All right, time to make sure this knowledge is sealed tight. We're going to run a rapid-fire drill to lock this tumor logic in for good. You ready? First one, squamous cell lung cancer. What's the hormone?
PTH-rp, causing hypercalcemia. Correct.
Next, small cell lung cancer. What are the hormones?
Plural. That's it. SIADH and ectopic ACTH. Exactly.
Okay, let's focus on that ectopic ACTH for a second. Are you going to see any suppression with 8 milligrams of dexamethasone?
Absolutely not. It is completely autonomous. There is zero suppression.
And here it is, the complete matrix. Just look at it. Squamous cell is locked to PTH-rp and stones. Then you've got small cell with its double hit. Ectopic ACTH giving you Cushing's with no suppression, and SIADH giving you that classic euvolemic hyponatremia. Oh, and don't forget, small cell just loves to metastasize to the adrenals, which can knock them out entirely. Logic sealed.
The rogue tumors have been exposed. Their internal logic, it's been mapped. The system is understood. But our endocrine mission is far from over.
This target, paraneoplastic syndromes, is now secured. But your next target is already on the board. Polycystic ovary syndrome. We're talking insulin resistance meets androgen excess in a vicious cycle of metabolic chaos. You have to master that logic. Let's move out.
to the PCOS and Reproductive Endocrinology module.